Your exercise session. Disclaimer: the information contained here should not be a substitute for the advice of a qualified licensed physician or other health providers. The information provided is for informational purposes only. Please check with your physician or healthcare provider with any questions or concerns. Warm-up. The beginning of every exercise session should have a warm-up period. For cardiac patients, that time frame is between 5 to 10 minutes and can be done on a variety of types of exercise. Slow walking around the track, using the new step on a low level, biking on easy resistance or walking on the treadmill at a slower speed are a few examples. Oftentimes it is described as very, very light or very light on the rating of perceived exertion scale. The warm-up part of your exercise routine is very important to your safety. During the warm-up part of your exercise session, your body is gradually being introduced to exercise. Your heart rate increases. Your blood pressure increases and your breathing rate increases. Aerobic. Increased exercise intensity means increasing your work from a resting state, which allows an increase in blood circulation, oxygen demand, range of motion in joints, increased heart rate and blood pressure. A few questions to ask yourself during this portion of the workout is: how hard would you rate yourself? Is it a fairly light to hard workout? Guidelines for ratings will be determined by staff. Can you talk while exercising? We want the answer to be yes. If it is no, safely stop your exercise. The recommended time for this portion of your session is 20 to 60 minutes. Cool down. An active cool down is recommended. Active cool downs involve continued movement at a slower, less intense pace. The muscles are still contracting and pushing the blood up to the heart, reducing the work or stress on the heart. The length of the cool down should be between 5 to 10 minutes. When you cool down, there is a gradual decrease of the heart rate and blood pressure. We actively cool down to allow heart rate, blood pressure, body temperature and respiration rate to come back to baseline or closer to resting heart rate and blood pressure. Points to remember. You want an active warm-up and cool down. An active warm-up is important for everyone. It is especially important for those who deal with angina. Proper exercise training improves the anginal threshold or the intensity where your angina symptoms start. 10 minutes of warming up is the recommendation. Without a proper warm-up, angina symptoms are more likely to start at lower workloads. The goal for any exercise session is angina-free minutes. Check out the video on angina for more information. Without a proper cool down or a short cool down, the body may experience a sudden drop in blood pressure due to blood pooling in the muscles. It may cause dizziness or lightheadedness. An improper cool down may also cause abnormal heart rhythm or angina symptoms.